Hello, everyone, and welcome to our second live update from Care for AIDS. I am tuning in from Nairobi this evening, and I'm going to wait just for a couple minutes for Justin to dial in from Atlanta, and then we're going to update you guys on what's going on both in our Atlanta office and here in Kenya and in Tanzania and in Uganda. Let me get Justin. I see Shannon. Hey, Shannon. There we are. Hey, Justin.
Hey, how are you?
Doing well. How are things in Atlanta?
Things are great.
Good.
Well, do we want to get started or want to wait a few more minutes?
I say we go ahead and get started. We've had some folks join. I'm sure they'll keep streaming in, but let's go ahead and get started.
Awesome. Well, thank you guys for joining us today. We pray for your families often, and we hope that you're all well in every sense of that word. As we opened up today, I just wanted to share a subtle change in language that we've begun to use as an organization. And you may have heard it elsewhere, but I think it's really important during this time because in our work, we have come to understand the real dangers of social isolation, and we get to see it, the effects of that firsthand every single day. And so, as we think about this term social distancing that we've all become so accustomed to, I just thought I would share today that it has been really meaningful for me to start using the phrase physical distancing instead of social distancing. Because during this time, although we are needing to be physically separate from one another, there's never been a more important time for us to be socially connected to one another. And that is what we're trying to practice with our clients right now in East Africa as we try to help them feel as socially connected as we can. And the same is true for our team here in the US. So my hope and prayer for all of you today is that you are physically distanced, but you are socially connected and close. And from all of us at Care for AIDS, we would love to be a place where you could come to find more social connection if you are feeling isolated in any sense. So I want to spend today mainly talking about what's happening in East Africa. I'll just quickly say that all of us in the US are doing extremely well. Our team is still working remotely. We're all healthy. We have seen a continued outpouring of support, both in word and in generous giving from our donors. And so the organization is in a really strong place. We're going to need more generosity in the months and weeks ahead. But for the time being, we are in a really good place and able to continue doing all of the work in East Africa that we need to do to serve our clients well. So I want to turn it over to Molly here, and I just want to get her to download on all of us what has been happening in East Africa since the last time we had one of these calls. So I'll start by just asking you, Molly, first of all, tell us how you and Andrew are doing in this time. If you don't know it, Molly is 21 weeks pregnant. So that adds another variable in this whole thing. But how are you guys doing, and how is the Care for AIDS staff at large doing during this time?
Thanks, Justin. Yeah, we are doing well. Personally, Andrew and I are doing really great. I'm right in that second trimester sweet spot of having lots of energy with nowhere to go. But we definitely miss having teams in this house. So we're super happy to connect with people when we can virtually. And just want to shout out to the many, many people who were on their way here in June and July and May, that we miss you. Your presence is definitely missed, but we're happy to stay connected digitally. The team here also is doing really well. It's been this is the 7th week since we have gone remote with our services. And of course, at first it was a difficult transition, just like all transitions into remote work when you're used to doing one-on-one and group counseling. But the team has been extremely resilient and under great leadership of our program staff and our senior management here. We even had a conversation today about how we can continue to improve the services that we've pivoted to offer. And we've kind of transitioned out of thinking of this time as this temporary stopgap. And we're thinking of it now as a time where we can really provide some great services for our clients. We're all very eager to get back into the field and to get back in person. But in the meantime, the team is really in good spirits and wanting to give the best care that we can during this different season.
And Molly, when we talked last time, one of the ways we were providing that type of care is through some new approaches that we'd not used before, telecounseling, and we were on the cusp of beginning to use more telemedicine. So how has that evolved and changed over the last few weeks?
Yes, so we now, we're offering everything under this umbrella of telehealth. And the way we talk about it is in two distinct services that we're offering right now. The first is telecounseling, which we started doing immediately as soon as there was the first confirmed case in Nairobi. And that has gone extremely well. We've actually, in the past couple of weeks, averaged about a 90% client reach rate across all the regions, which means 90% of the clients who are enrolled in the program are getting weekly one-on-one counseling from both their health counselor and their spiritual counselor at the center where they're enrolled. So it's been amazing to see not only that the clients are willing to engage with us in this way, but that the staff are able to, like you said, Justin, like really still stay very connected socially and help clients kind of get through this very isolating time, and help kind of counsel them through that double isolation that they might be feeling right now. So that's telecounseling, which is not too far of a stretch from what we were doing one-on-one in the centers. But then I think on our last call, we had just considered the idea of starting with some telemedicine services. And we launched that a couple weeks ago, and it's been going incredibly well. So we have, some of y'all know, about 8 clinical staff on our team here in East Africa, and they're spread throughout the regions. And by clinical, I mean they're either a PA or a registered nurse. And what we've done is, under the leadership of our brand new health TA, her name is Janet, and I think I mentioned last time that her first day on the Care for AIDS staff was our first day going remote. So she has been just trial by fire, but has built this whole telemedicine platform for Care for AIDS in this time that allows those 8 clinical staff to essentially be on call. We've assigned each of them to a particular region where they're on call for all the clients in that region. And what they're able to do during this time, when clients are being encouraged not to necessarily leave their homes, or flood any medical services with non-emergency cases, they're able to call our clinical staff and receive prescriptions over the phone, receive basic care for opportunistic infections, and we're also able to provide the funds to pay to get those prescriptions filled for the clients. So we started that a couple weeks ago, and it's been going incredibly well. Lots of clients have taken us up on that offer, and the clinical staff are doing an incredible job balancing that along with their other roles right now. So those are the 2 main things that we're able to offer the clients right now: telecounseling and telehealth or telemedicine, all under this umbrella of what we're calling telehealth right now for the season.
That's awesome. Thanks for sharing, Molly. I want to pause for a second. I have some more questions for you, but I want to invite those who are watching, if you have questions that come up, please put them into the comment box below so that we can come back to them and answer them at the end of our time. Molly, one of the things that we're seeing a lot in the news, which we unfortunately only get some of the hard stories that are coming out of East Africa right now, and one of them is around obviously the scarcity of food and a lot of riots and stampedes around these food distribution points. And as I understand it too, the Kenyan government is now restricting who can even distribute food at all. So explain and update everyone on how we have adjusted to helping our clients have access to food, and what does that look like over the last few weeks?
Yeah, so it has been unfortunate that a lot of the hard things that are happening in East Africa have been in the news. Um, One of the difficult side effects of COVID-19 in East Africa has been, along with a lot of government restrictions that are trying to minimize exposure and really contain the spread of the virus, it's also put a big strain on the economy. So one of those things has been the curfew here in Kenya, which was just extended for another 21 days. So it's essentially 7 p.m. to 7 a.m. Everyone is confined to their homes. And there, like I mentioned last time, there has been some instance of police brutality to enforce those curfews. So that has been one thing that's been difficult in a lot of the communities where we're working, where it's really just difficult to self-isolate in your home. And another complication has been a food shortage. So with the curfew and with different movement restrictions, a lot of the community members where we work in kind of the more informal settlements don't have the day labor opportunities that they had in the past. So there's less work available, which means less income, and food prices have gotten a little bit higher. So that obviously creates a really difficult time for a lot of the families in those communities. So an incident around Easter weekend in Kibera actually prompted the government to create restrictions on food distribution. So what was happening is different organizations and individuals were going out to kind of alleviate these hunger issues, distributing food in those informal settlements. And in Kibera, there was some violence associated with one of the food distribution methods, just because there wasn't enough food. There was lots of people, a lot of desperation. So it turned into a bit of a violent situation that wasn't prolonged. But because of that, the government has put in place some pretty tight restrictions on who can distribute food and how. The good news is for Care for AIDS, as many of you know, we've been distributing months worth of food to each of our clients and their families at the beginning of each month. Some small way that we can help support them in addition to our telehealth services through this time. So as of today, actually, we have gotten our certificates from all of the governments, all the regions where we work. Mombasa was the last one that we got today. So we are still able to distribute full food in bulk to all of our clients, which has been really, really good. So we are working with the government, and it hasn't restricted any of the services that we're offering. But I would say definitely keep Kenya, Tanzania, and Uganda in your prayers, as a lot of the families that aren't necessarily connected to Care for AIDS in those same communities are struggling to make sure that they're getting enough food on a week-to-week basis.
Mm. Molly, you raise an interesting point that I think a lot of the media attention is focused on Kenya, at least what we're hearing here. And we may be guilty of this as well, of talking too specifically about Kenya, but we don't want to forget our brothers and sisters in Tanzania and Uganda, and they are experiencing the same effects to some extent, but they're handling them in different ways, and the impact is being felt a little bit differently. So can you share with us like how this is affecting people in Tanzania and Uganda as well?
Yeah, definitely. So for reference, I have to check my stats over here. As of today, in Kenya, we've got 374 confirmed cases of COVID-19. The good news is 124 have recovered, and there have been 14 deaths. In Tanzania, similar numbers across Kenya, Tanzania, and Uganda. Tanzania has 300 confirmed cases as of today, with 48 recovered and 10 deaths. And then Uganda actually closed their borders and started doing travel restrictions much earlier than some of the other countries. And they, as of today, only have 79 confirmed cases, 47 recovered, and 0 deaths, which is great news out of Uganda. That said, even though the cases are relatively confined in each of the countries, each country has taken on similar movement restrictions that have been applied in the US in many cities. So it's essentially shelter in place, not as strict, but there's definitely a curfew in each of the countries. And Uganda has actually had probably the strictest movement restrictions since the beginning of the outbreak in March here. So one of the complications that has brought up is some of our clients in Uganda over the past couple weeks have had issues accessing their medication. So our staff is helping out with that. But the big thing in Uganda is there's no private or public transportation allowed right now. So they're by far the most restricted. And then in Tanzania, it's similar to Kenya, where there's public transportation restrictions, social distancing enforcement of, standing on the streets, wherever you are. They are still allowing churches to meet and gather in large groups in Tanzania, which some are concerned about, but our centers are still not meeting, still doing all telehealth there. But that's the general outlook of all three countries. And each of them have recently extended those restrictions for another 2 to 3 weeks. So we'll see where we end up.
Well, one of the things that's really encouraging is that the number of cases hasn't grown as quickly as we would have expected. To have that few cases across those three countries in a context where you would think that it would spread very quickly, living in close quarters, not always access to the best hygiene and sanitation. So I found it interesting, as you and others have theorized about what is it that is keeping the virus at bay in that region. And I know that there's not a definitive answer on that yet, but what are some of the things that you're speculating about in terms of why it's not spreading quicker?
Yeah, it is fascinating, and it's such good news for the region. Honestly, it's such a pleasant outcome so far that the cases have been really restricted. We haven't seen an exponential increase in any of the countries so far. And I'm, of course, not a doctor, but I do think a big part of it, probably in Kenya and Uganda in particular, is that the governments in all three countries really took really swift action. I remember the day that the first case was confirmed in Kenya, a lot of movement restrictions were put in place. And we followed suit at Care for AIDS. We went remote the day the very first case was confirmed, because of a lot of the issues you mentioned, where people were predicting that it would be a very rapid spread because of close communities and hygiene, sanitation, access. So I think that's a huge part of it. It's also interesting to hear. I heard something from the CDC this week that warmer temperatures are hopefully going to help flatten the curve in the States. And of course, we're on opposite seasons here. So some folks have thought that maybe the warmer weather has helped prevent the spread in the beginning. But as we transition now into rainy season and into winter, a lot of folks, some models that we've seen have said that maybe June or July would be the peak in East Africa. So it's yet to be seen. I'm praying and hoping that it remains contained, that we don't see exponential cases here. And I think it's something that's a very fascinating public health study. I know I'm going to read a lot of articles about it for the next couple of years, I'm sure. But those are the two main theories right now.
So I know we've talked about a lot of the hard stuff, the challenging stuff that people are going through in that region of the world, but there's also some really encouraging, inspiring stories coming out of the Care for AIDS program at this time. So I would love to just hear a story or two of things that you have found really encouraging about our clients during this time.
Yeah, there are two stories in particular that are so fun and uplifting that really are a testament to our empowerment department. There are two graduates that we have gotten news from, one in Kisumu and one in Mombasa. And the woman in Kisumu who graduated from our Manyata Center, she and her son are making these bulk supplies of liquid soap, which is the skill they learned through the empowerment part of the Care for AIDS program last year. And because some of the local stores aren't able to get their supply chain fixed very well, she is actually supplying the bulk liquid soap to all the stores that are selling liquid soap for prevention in the community, which is amazing because it has absolutely revolutionized her personal economic situation. And I'm just so excited in the coming months to follow up with her and see how that really impacts her family and has a ripple effect in her community. And then another graduate of ours in Mombasa, similar, she has her own store, but she's reported selling liters upon liters of liquid soap every day to her community members. And she's also helping educate her community about the importance of hand washing and just very important hygiene, particularly during this time to help protect people against COVID-19. So it's very cool that both of those clients have not just kept what they learned to keep themselves and their families safe, but they're sharing that, and it's also helping them long-term economically. So it's just a really cool picture of how the program impacts these clients long-term and how there's always a ripple effect in the communities. So those are two really encouraging stories of many, many that we'll keep sharing over the next couple weeks.
It's incredible. Well, thank you for those updates. I want to go quickly to you guys to ask, are there any questions that you have or anything you'd like to know more about before we wrap up today?
I see my kids.
I see my kids are, our kids are watching, which is another way to distract them during this quarantine time. So, hey guys. I was also just going to ask you, Molly, before we close, just to share if there's anything specifically that we can be praying for. We know that we need to be praying broadly for a lot of people that are being affected by this, but I'd love to know if there's any specific ways we can pray. But what else were you going to share?
I just saw a quick question from Dee Dee, I think, about the number of people being tested. So there's pretty widespread testing. I don't off the top of my head know the numbers, but I know it's definitely in the tens of thousands that they're testing. And they're doing some really good contact tracing through the Ministry of Health. So anytime there's a positive, they're tracing those contacts, having them come in for testing and then reporting on that. So the numbers are low, I think, in a way that's actually well representative of how many people are positive. So that's a good thing. Hopefully they're not false security, but that was a good question, Dee Dee. And to answer your question, Justin, something that we talked about this morning with the leadership team here in Africa was that our prayers, obviously we're all keeping our clients in our prayers constantly. That's a given, and we covet that you guys would continue to pray for our clients. But we also need to be very specific in praying for our staff. There's something that we have kind of taken as a mantra this year on the team, is that we need to, like, work-wise prioritize our relationship with God, our relationship with each other, and then our relationship with clients. And then we have to be very careful never to reverse that order for our own health and for our own flourishing. So I would say pray for our staff members. Many of them, just like you guys, are juggling so much, working from home, having their kids out of school. A lot of Kenyans in particular